Just ahead on this edition of Being Well, interventional cardiologist Amit Dande will be here to talk about peripheral vascular disease. We'll learn all about the risk factors and treatment options that are available. It's an informative half hour coming up, so don't go away. Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston. Thanks for joining us for this edition of Being Well. We're talking with cardiologist Dr. Amit Dande, and we've got a lot of stuff to cover today. But first, I want you to explain to the viewers, you're a Prairie Heart Institute doctor practicing at Sarah Bush. Can you explain the connection between the two and how that works?
Sure. Prairie Heart is based out of Springfield, and we have various hospitals that we go to. Based on the size of the community and the size of the hospital, there are certain locations where the Prairie Heart doctors will stay full-time, and other places where they will travel from Springfield to hold clinics. So based on the size of the community here and the size of the hospital, we decided the best option was for cardiologists to stay here full-time, and there are 2 of us right now, which may expand in the future as we get more patients. So that's really how it works.
Okay, so you're a cardiologist, so your specialty is the heart. Let me ask, as you were going through medical school, I like to ask our providers this, what was it about the heart that kind of intrigued you to seek out that specialty?
Well, you know, the heart is a very central organ and supplies blood to the rest of the body. It is kind of the motor that runs the engine that runs the whole body. And the important thing, the thing that attracted me to the heart is it's a moving organ. And if out of all the other organs, it moves continuously day in and day out throughout your life. So there's not only the aspect of anatomy, which is the structure, but also the function. And the structure and function go along together in a way that's really very, very impressive if you actually get down to, you know, how the heart works. What we do in cardiology is not just fix problems that are relating to the structure of the heart, which is what the surgeons do. They will cut open the heart and fix stuff that is broken. But we also fix the function of the heart with medications, and it's a physiologic thing. When medical students start out with physiology, oftentimes the first thing that they're taught is about the heart, because the physiology of the heart is so important in the blood flow and what regulates it. It's kind of a very fascinating field. So I think, in my first year of medical school, we went through anatomy and physiology, and that's when I really got interested, and I used to sit with a lot of books just to delve deeper into, what is known about how the heart works, and that's how I got interested in it.
So in your practice, what are the scope of cases, or what is the, because we've talked that cardiology is getting very specialized, so what kind of things do you treat?
So primarily the people that I see have some problem with their heart, but also with the blood vessels. The specialty is cardiovascular disease. Cardio is heart, vascular is blood vessels. And so I get a range of patients that have either a problem specific to the heart, or a lot of times the problem lies with the blood vessels that feed the heart, or the blood vessels elsewhere in the body. I also get people who, for example, have had a stroke, because a lot of them have problems with the blood vessels that go to the brain. And so, and a lot of times the stroke is related to a heart condition. So, it's a wide scope of practice. There are also some people that have something that is related not directly to the heart, but something that is, for example, a tumor or something that is compressing the heart on the outside. And so, it's fairly broad-based, but anything primarily related to the heart and blood vessels is what I deal with. So
our topic today is peripheral vascular disease, or PVD. Can you explain for the viewers what that is?
Right. So the peripheral vascular disease field basically involves blood vessels outside of the heart.
Okay.
So the heart is supplied by its own blood vessels. Every organ is supplied by its own blood vessels, but peripheral means outside or in the extremities. And so when we talk about peripheral vascular disease, it is disease of the blood vessels that are outside of the heart, and that would encompass basically the rest of the body, but most importantly the blood vessels that supply blood to the brain, the blood vessels that supply blood to the arms and the legs, and blood vessels that supply blood to the major organs like kidneys and the intestines.
So how does someone know if they have a problem with their vessels?
Right, that's a very important question. And sometimes it is very obvious that you have a problem, and sometimes you don't. And for example, one of the diseases of the blood vessels is an aneurysm, and people are familiar with the term aneurysm, and I see a lot of patients come and tell me, oh, my relative died of an aneurysm. What they mean usually is an aneurysm in the brain, which can break open and cause a bleed, which is usually very fatal. It's fatal very quickly. But aneurysms are ballooning of the blood vessel, which can happen anywhere. And the most common place for an aneurysm is in the belly. So the main blood vessel that comes out of the heart and supplies the body is the aorta, and it kind of makes a curve in the chest and goes down into the belly. And it can get an aneurysm in the belly, or it can get an aneurysm in the chest where the wall becomes weak and it balloons out. There is no good way to tell who has an aneurysm. Most patients will never, unless it's too late, when they start having pain in the belly, it's, they will not really realize it. And so for those type of diseases, we have screening programs where we actually go in and look. Most of these aneurysms right now are diagnosed when people have a CT scan for unrelated reason, like they go to the emergency room and are having some pain in the belly, which may be a gallbladder or something, but they get a CT scan and then we find out that there's an aneurysm. So a lot of people are diagnosed just incidentally. But the other major disease process in the blood vessels is development of blockages, which is the same thing that happens in the heart, which can cause heart attack. And that process is called atherosclerosis, which basically means hardening of the arteries because of deposition of fat. And fat
so that's
being cholesterol.
Talking about high cholesterol, you're getting atherosclerosis.
Right. And that is the commonest manifestation of peripheral vascular disease. And that process can happen in the blood vessels that supply the brain in the neck and can cause a stroke. It can happen in the arms, and that can cause pain in the arms when people do something with the arms. And some people will have pain in one arm, not the other arm. It primarily will happen when they try to do something with the arms, the repetitive motions of the arms. But more commonly, it happens with legs, because you walk on your legs, and people will come in with pain in the legs when they walk. And typically, it'll be a patient who smoked, because smoking does cause this process to happen very quickly, and in younger patients. But if you walk a certain distance and it hurts in the back of the calves or in the back of the thighs, that's usually something that suggests there's a problem.
Is there sometimes swelling involved?
Right. So the blood vessels that feed the organs and the arms and the legs are the arteries, which carry the blood from the heart to the organ, and the blood vessels that take the blood back are called veins. If you have a problem with the veins, yes, then you can develop swelling, but that's a different disease process. So peripheral vascular disease is very broad. You can get a problem with the blood vessels that bring the blood from the heart, or the vessels that carry it back. And so yes, if you have a problem with the veins that carry the blood back, then most commonly it starts off as a swelling, and it can progress again to pain or heaviness in the legs, because there's a lot of blood sitting down in the leg, not getting back up to the heart because the veins are not working correctly. And that can also cause pain in the legs, but usually it will be accompanied with a lot of swelling and changes in the skin. And so that's another aspect of peripheral vascular disease.
So, I mean, we've also heard PVD is kind of the big term, but I've also heard of PAD, which is peripheral artery disease. So is it better or worse if you have the disease in the veins or the arteries? What's the difference?
Right. In general, a peripheral arterial disease is what I was talking about, blockages in the blood vessels that supply the blood to the organ or to the arms and the legs. We know that is associated with having blockages in the blood vessels to the vital organs.
Okay.
So the blood flowing into the vital organ is compromised. And so that's a much more dangerous condition. And we've recently found out through long-term studies that if you have peripheral arterial disease, which means the blockages are in the legs and not getting enough blood flow to the legs, you are much more likely to have a heart attack or a stroke than the normal population. And that's why the heart doctors stepped in and said, we don't even see a lot of these people being treated appropriately, because what you need to treat is not just the fact that you're having pain in the legs when you walk, but that you need to be on medicines to protect your heart and brain, because most people are going to die from heart attack and stroke. They're not going to die from having pain in their legs. That's just a marker for a more severe problem that could be going on in the heart that they might not feel because they don't walk far enough to get pain in the chest.
Okay.
Because the legs are bothering them so much. And most people will just cut back on the activities slowly and not do the activities that cause them pain in the legs. The vein problems are not directly life-threatening. So when you say vascular disease, you could mean artery or vein. Peripheral arterial disease is much more dangerous than having a vein problem.
So which one do you see more of here in our region?
It's both very common. The process of blockages starts very early, even in young patients who die from, say, automobile accidents. If there's an autopsy performed, we see the early beginnings of plaque.
Okay.
And it's progressive, and it gets worse, and that's part of the aging process. So everyone will have some blockages. Nobody has very clean arteries. But it depends on where the blockages happen and whether they can be caught before they become a bigger problem. So everybody will have some plaque buildup, and we can see those by the tests that we do, but we don't fix the blockages unless they get to a certain point. Either their patients are feeling the problem or they get up to a 70% or more. Traditionally, that's the blockage we like to fix, because at that level, the blood flow is compromised where the organ starts to feel the problem, even though the patient might not yet feel the problem.
So you had talked about some tests, like people can get a CAT scan for something else and find out that they have a vascular issue. What other, if they think, okay, I've got this heaviness in my legs, what kind of tests would their doctor do to sort of rule out or maybe determine that they have PVD?
Right, that's a very good question too. We have a lot of non-invasive tests, which means we don't do any needles or anything to figure out what the problem is. The simplest test is to compare the blood pressure in the arms to the blood pressure in the legs, and that is what is called an ankle brachial index. And all it is they put blood pressure cuffs on the feet at 3 places, and then they put blood pressure cuffs on the arms. The blood pressure should be the same throughout the body. And if you imagine that there is a blockage that is obstructing blood flow, then the blood pressure beyond it will be lower because not enough blood's getting down there. So that's a very easy way to tell whether there's enough blood getting down to the feet or not. And that also tells us the location of the blockages, because there's 3 blood pressure cuffs. We can tell where the blood pressure dropped, and that tells us where the problem lies.
Okay.
And so that's one of the simplest tests. We can do ultrasounds to actually see the blood vessels. We can do CAT scans, which are dedicated for the blood vessels instead of this incidental finding we talked about before. So we can put some dye in the blood vessels and do the CAT scan, the blood vessels will light up very bright, and we can tell where the blockages are. And then, finally, we can do an angiogram, which is done in the cath lab or in the interventional radiology suite, where we do the same thing. We put the dye in, but we actually see the picture on the screen right in front of us, and we can actually do the procedure to fix at the same time.
Okay. So you had said if it's something has, like, did you say 70% blockage, that's when you go in and fix it. So how do you fix these problems?
So the first step is to try to get a wire through the blockage. So we have very fine wires and we have thick wires, and so first thing I look at is, when I look at the picture, I see how bad the blockage is and where it's located, and based on that I decide on what kind of wire am I going to use. The choices keep expanding and the technology keeps expanding. So when I decide on a certain type of wire, I manipulate that very gently across the blockage without breaking off the plaque. The plaque is very friable. It can break off and go down and block the blood vessel down. So we have to be very careful with that part. And then over the wire we mount a balloon, which is made of plastic, and we take it down under X-ray. We're looking at where the blockage is under X-ray, and we take the balloon down to that location, and then we inflate the balloon on the inside. And once we inflate the balloon and deflate it, most of the times it looks great. And that used to be the process about 20 years ago. We would leave it at that, and we figured out that the blockage would come back in a significant number of people over 6 months. The blood vessel would just recoil and the blockage would come back. So then we figured out that we should probably put something in there, and we came up with metal stents, which are like a mesh. And it's the same process. It's mounted on a balloon, and so after I've opened the blockage with the balloon, I take out that balloon and I put in this other device where the balloon has a metal stent which is crimped on top of it. And I take that to that location, I inflate the balloon, and the metal part will hug the wall of the blood vessel, and when I deflate the balloon, the stent stays there.
Okay.
And then I take out the balloon. So that's the next step. And that's really where we are now. In the heart, we have medicated stents where they put out some medicine over the first 6 months or so to inhibit scar tissue buildup, which is the problem that happens with metal stents. Most of the times in the arms and the legs, we don't have that option yet. The stents are all still plain metal stents.
So if people are going to have one of those stents put in, are they in the hospital for a day? Do you go home that day? What's the recovery like?
Well, that's the difference between having this versus surgery. All of these problems used to be fixed with surgery. In the heart or in the blood vessels of the legs, you could get a bypass where basically they take a plastic tube or a vein from the leg, and they connect the blood vessel before the blockage to the blood vessel after the blockage, so that you can route the blood around the blockage. And that used to be the treatment for everybody. For the heart, it involves opening up the central bone here, the sternum. It takes about 2 months to recover from that. For the legs also, it's major surgery. In fact, vascular surgery has one of the highest rates of cardiac complications of all surgeries.
Okay.
So that's why we've moved to fixing these from the inside, and one of the bigger advantages is that people are back on their feet right away. We give them some instructions about not lifting anything heavy for a few days, because most commonly we go in through the groin, and when we come out, we hold pressure to make it stop. And there's a little blood clot in there where the tube was, where we went in. And if you lift something heavy, that puts pressure on that area, and that blood clot might come off, and you might have a bleed. Really, that's really the only thing that we worry about. Once we're done with the procedure, if everything went well during the procedure, then we're only worried about the place that we went in the groin, and that's the only reason we give any kind of restrictions or. But other than that, people can go back to doing whatever they were doing and really get back on their feet.
That's amazing.
Right, and that's one of the things is even the surgeons are moving towards minimally invasive type of devices where they make smaller and smaller incisions, because the smaller the incision is, the quicker the recovery time. And so most of the surgeries in the belly are done with cameras, laparoscopy, and that is one of the advantages of that is you can recover very quickly. The bigger the incision, the bigger the surgery, the length of the surgery, that's what impacts on recovery time for most people. And so this is an option, a minimally invasive option for most people, where we can fix everything from the inside. Once we come out, we just have to tell them, don't take it easy for a couple days, but otherwise you can go back to doing whatever you're doing.
Are there certain people who are more at risk for getting PVD, age groups, lifestyle choices?
Yes, definitely. The same as heart problems are more common in certain groups. It's the same people because it's the same process. It's the process of deposition of fat inside the blood vessels. The blockages are from fat, and the old term is atherosclerosis. Athero meaning fat, and sclerosis meaning hardening. And the blood vessels harden over time due to fat deposition. Some people have the genetic component. Their family members have had this problem, and they're more likely to get it. But people who have diabetes are very high risk. People who have uncontrolled, untreated high blood pressure, people who smoke. And most commonly, what I see in my practice is people who smoke, and if they don't give up the smoking, will keep coming back. You know, we can fix the problem, but the blood vessels are very long, and the problem might come back at another place down the road. And some people I see every 6 months because they don't quit the smoking. And that's the cure for this is not just getting a stent, but to actually treat the factors that cause it, and the factors that cause it is uncontrolled diabetes, high blood pressure, smoking, and people can do a lot with eating a healthy, balanced diet and getting regular exercise. Exercise is good for your heart, it's good for the blood vessels, and that can delay the progression of this disease and prevent problems down the road.
Is there a certain age when you start seeing people come in with this?
Yes,
and
it's mostly.
And is it getting younger?
Yes, mostly it is older people. I would say that most of the people who get blockages tend to be over 65. But we are seeing it in younger people, and it is very unusual to see this in somebody who is not a smoker. If you're younger than 65, it's very unusual to be not a smoker. You either have smoked at some point in your lives or are still smoking, and smoking just makes these problems come maybe 20 years earlier than they would otherwise.
Okay. So you talked about some prevention techniques. When would you recommend, if someone may think they have it, when should they call their doctor?
Yes, if you notice any symptoms of we talked about pain in the legs when you walk. Pain in the chest when you walk would suggest a problem with the blood flow to the heart. Some people just have shortness of breath, and that would be also could be related to lack of blood flow to the heart. If people let that progress, and some people don't for reasons that we don't understand, don't get the pain in the legs, but the first manifestation is that the skin breaks down in the legs and they get wounds that won't heal. That's another big chunk of the population that has this type of a problem. The blood flow is not adequate to heal the wound.
Okay.
But by that time it's gone quite far. But the first symptom usually is pain in the legs when they walk. But like I said, some people will just stop doing the stuff that causes the pain, adjust their lifestyle, and ignore the symptoms. Sometimes the body finds a way to route the blood around blockages, and so people can develop the collaterals, which is blood flow that goes around the blockage, and your blood vessels will grow around and try to supply that part, and that can happen. And so that may be why some people may have some symptoms and then not have any more pain until it comes to the point where it progresses and leads to ulcers. Some people will have pain in the night because at night the legs are up and they have just enough blood flow to get down there when the legs are down because of gravity, but at nighttime they start hurting, and so after 2 or 3 hours after they go to sleep, they start having some pain or cramps in the leg. And I've seen some people who just have weakness of the legs and just can't walk very far, and we sometimes find that correcting the blood flow improves that. Blockages in the neck are very hard to find early unless you have an ultrasound. Some places offer a screening test where they will put an ultrasound and check for blockages, but usually the first manifestation of that is a stroke, and it's too late by then. But and aneurysms we talked about, it's hard to diagnose. A lot of people, by the time they start having pain in the belly, it's too late. Aneurysms are very silent.
Okay, well, Dr. Dande, thank you so much for coming over and giving us some great information, and most importantly, some prevention ideas for PVD. Thank you.
Thank you very much for having me.
For thousands of years, the Chinese have used acupuncture to treat many conditions. Today, many Western health experts have incorporated the ancient art into their practice. Stress, digestive problems, headaches, mood disorders, infertility, and chronic pain are just some of the ailments acupuncture may help. Now you can add hot flashes to that list.
It starts at your toes and feels like your blood is getting hotter.
Polly Gilgenbach gets hot flashes.
You break into a sweat, you turn red, people wonder what's wrong with you.
Up to a dozen hot flashes every day.
You feel like you can't concentrate because you're hot and sweaty.
When the heat subsides, chills set in.
I live with this, the blankie. Sometimes I'm hot, sometimes I'm cold, and then I have to switch back and forth.
Rather than take medication, Polly opted to try acupuncture.
What it involves is placing very small sterile needles along the body on specific points. Everything feeling okay?
Mayo Clinic acupuncturist Molly Mallory says the traditional Chinese philosophy behind the practice is to use the needles to bring balance to energy that flows through the body.
And the energy that flows through your body we call qi.
If this energy gets out of balance, you can develop symptoms. In Polly's case, hot flashes. Here's a more scientific explanation of how acupuncture may work. Needles in the skin stimulate pathways that travel through peripheral nerves to the spinal cord and brain. This causes your body's natural painkillers called endorphins to rise and other chemicals to change, unblocking trapped energy and restoring its flow.
So the acupuncture and the needles are allowing your body to get back into balance and bring about a state of homeostasis,
which is a state of wellness. This is Polly's 6th treatment. She says the needles do not hurt, she can barely feel them, and the sessions are relaxing. Plus, they effectively treat her hot flashes.
For the most part, I'm down to 2 or 3 a day instead of 10 to 12.
Fewer hot flashes, which are much less severe, make for much better days at the office and in life. For Mayo Clinic News Network, I'm Vivian Williams.
Production of Being Well is made possible in part by Sarah Bush Lincoln Health System, supporting healthy lifestyles, eating a heart-healthy diet, staying active, managing stress, and regular checkups are ways of reducing your health risks. Proper health is important to all at Sarah Bush Lincoln Health System. Information available at sarahbush.org. Additional funding by Jazzercise of Charleston.